We want to turn now to your health. Officials nationwide are bracing for a post-Thanksgiving surge of respiratory illnesses. Family gatherings and large crowds at shopping malls and airports are the perfect breeding ground for the triple-demic of the flu, RSV, and COVID-19. CBS News Chief Medical Correspondent Dr. Jon LaPook is with us. Dr. LaPook, so good to have you. So if you're sick, why is it important to test?
Well, it's important to know the diagnosis because it can affect the actual treatment. For COVID, for flu, there are specific drugs that can be given, especially if you're at increased risk of progressing to more severe illness. Now, for RSV, there's no specific treatment, but there are things to know. For example, it's very important to look for any evidence of trouble breathing, especially in infants. For example, they can have retraction or pulling in of the muscles of the chest wall or neck, and that can mean that the baby or infant is just working too hard to breathe and needs to be seen by a health professional right away.
And doctor, is there any way to tell the difference between COVID, flu, and RSV?
Well, unfortunately, you can't do it by symptoms alone reliably, so you need testing. Now, if you have access to COVID testing at home, you can start there. There is no FDA-approved rapid test at home for RSV or flu. So let's say you have the COVID test, it's negative, but you have symptoms, it could be a false negative. So then you may want to go to a hospital urgent care center, to your doctor, health professional, and they can do a PCR test that can look not just for COVID, but for RSV, flu, and a lot of other things. Now, it may not be covered by insurance, so you may want to check on that. And Norah, I'll leave you with one thing, which is it's not too late to get an updated COVID booster or a flu shot.
That's good advice. And there were some folks in my family who didn't have RSV, COVID, or the flu. There's other stuff out there too, right?
Absolutely. Yeah, adenovirus and a bunch of other things that can be tested for on that big panel of PCR testing.
Good information. Always good to see you, Dr. LaPook. Thank you.